I don't see a share button. Oh no,
Where is the share button? It is there.
It's there.
The green one, yeah. Yes.
Okay. Can you all see my screen?
Yeah, we can see your screen.
Yes. You can make it full. I think it's full only, but still.
Now?
Yes. Excellent, excellent, excellent. Okay. You can quit now and then maybe after our introduction, maybe we can start.
Yes, yes. I will go back to this window. And
Yes.
yes.
Anupama, you want to say anything to start before, or I will start with the opening remarks?
No, I think you should go ahead and start.
Okay. Okay. I think this is already alive in the Facebook also already. There will be a recording going on. So today being holiday in India, there may be some people might be watching it later. October 1 is a holiday in India right now, today and tomorrow, basically. And so there will be people are joining, but there will be people will be joining. So I will just do my official introduction. In fact, I am also not in Trivandrum. I am in Colombo. Today morning I am in Colombo. I think the right place to talk about what is called the planetary health, basically, because also a lot of coastal belt and other things. So I'll come to that later. So thank you very much for all the people who have joined, both participant and the speaker. This is a program organized by the International Institute for Migration Development and Helpage India Delhi office. And some of you are attending this particular program today, coming into the to listen to Professor Ajay Bailey. IMAD started a few years back, basically in 2019, to provide capacity building for young researchers and also provide evidence-based policy for the both state and central government. I would like some of you to go and look at our website. We have a lot of capacity building program, a lot of research is going on. And this collaboration between Helpage India and IMAD started when we had a major project with the United Nations Fund for Population Activities on Elderly Care, where we had a TAG meeting and where we have Professor Mr. Rohit from the Helpage India came down. So we had a meeting. We thought we should do something together. This is one of the first activity. We'll do several activities. This is the first activity IMAD and Helpage India is doing on the October 1 to celebrate the International Day for the Elderly Person. I'd like to welcome all of you. And in particularly, I would like to welcome our partner, Anupama Datta, who is representing the Helpage India. She is currently the Head Policy Research Advocacy, Helpage India. Also, I would like to specially invite, to say welcome to Professor Ajay Bailey. Ajay Bailey is right now, he's in Netherlands. I think it's early morning time. When I sent a message to him, he has agreed to speak to us. I think this is a great opportunity for people to listen to him. He's currently a chair and head of the Department of Human Geography and Planning. He's at Utrecht University in Netherlands. He's working on both migration, anti-aging, and health for quite a long time. But I've known him since his PhD days. So almost probably 15, 20 years. So we know him, and we did some work together. We organized a special issue in population, space, and place. We'll be also coming to Trivandrum next month. We have a big conference organized between Indian Council for World Affairs and the IMAD in Trivandrum on November 17, 18. And we are also planning for a few more researches in the coming days. When I told him about this meeting, I would like him to speak. He has agreed to speak. And he's speaking on care in the era of planetary health and environmental disaster. You know that climate change is coming in a very big way. Everywhere it is happening. Kerala had floods. Kerala had landslides. And we know that now a lot of issues are happening in climate change. And everybody talk about climate change. But then what happened to the vulnerable citizens, particularly elderly? He's going to speak on that. And we have a postdoctoral fellow, Dr. Irsat, who is currently with us for our major project. He will be delivering the vote of thanks after everybody complete their introduction. The program will be like this. After my introduction is almost over, Anupama Datta will speak for a few minutes. And then we'll give you a large chunk of time to Professor Ajay Bailey to speak 30 plus minutes. And then we'll open it up for people to have some discussion. And then he can have one response for all the questions. Then we'll wind up. We're thinking of total an hour between now and something. So we will keep the time so that everybody can participate. With that, I'll stop and I request Anumama Tata to speak a few words for this particular meeting. Thank you. Thank you, everyone.
Yeah, thank you, Professor Rajan, for collaborating with us to do this very short and focused discussion. And very happy to welcome Professor Ajay Bailey. I've known him from the days that he was doing research on urban cities and elderly people, and I've worked with his students for some time. Uh, Pleasure that you're here. And this is a subject which we are actually exploring, because we are an organization, like Professor Rajan is a research expert. We are not experts, but we do implementation and we do intervention in post-disaster situations, and we have been doing it since the cyclone in Odisha. So we have good experience of how it works on ground, and we have certain standard operating procedures, if you may say, about how we intervene, in these disasters. And initially, we found that the elderly were the last to receive any such specific intervention. Their needs were overlooked. They were generally not able to articulate, not able to navigate the system of relief and rehabilitation both. And they required both, because we realized that. Uh, Disaster impacts everybody. Everybody loses something or the other, but when elderly lose, and they may lose a young adult from the family. They may lose their livelihood source. They may lose many other things. Their health may be like at a stage where they have multiple entities, and with this disaster, something else happens. They're unable to access the systems. So these are some of the things that we initially observed, and then we sort of started intervening in a way where we thought that we will not just provide relief, but also empower them, and in certain ways build their capacities to deal with such occurrences if it at all happened later in their life. And so big example of this is that we built an old age home for the tsunami victims in Tamil Nadu, where elderly people lost very heavily, and we thought that they deserved a life of care, and care with dignity. That was the idea. So there are many other examples, but before I would like to play two films of about how we sort of build their capacities. But before that, I'd like to just quickly, for record, just put some concerns that we have, and I'm sure Professor Bailey will answer a few of these. What we see is that the disasters are increasing and intensity is increasing. More and more people, more and more areas are getting, disaster prone, and they're getting affected by disasters, whether it is heat or cold wave, whether it is cyclones, whether it is floods. These are very common occurrences now, and the extent of damage has actually increased over the years. But we also see a trend of increasing elderly people, and elderly people living alone, and those living only with the spouse. So their social network is much smaller, and their access to help is much less. And of course, when we talk of elderly, we talk of longevity increase. So we see an increase in the age group of 80 plus, and those are the people who require a lot of extra assistance, which the system is not always geared to provide. And in that 80 plus, we all know that majority are women. So these are some of the areas that we think are very important from the policy perspective. We should talk about it more. And when we do research, we should focus on these areas. Like I said, loss that normally people experience in these disasters is both direct and indirect. Whatever the family loses also impacts the care quality for the elderly people. If the in Uttarakhand, we found that when families lost heavily after the flash floods, the some of the people were actually telling us that we used to eat 3 meals a day, now we are only eating one. So elderly, the care component of elderly actually suffers a lot, and those elderly whose families were living away, because we deal with poor elderly people, so their access to care, very basic care, ADL and IADL, was extremely compromised. So these are some areas that are important for us. COVID was another kind of an example for us to learn from, because COVID brought, it was not a disaster in the natural disaster sense of the term, but people were isolated, and elderly people living alone in cities because of lockdown and all that lost contact with their caregivers. It was very difficult for them. They lost, they were not tech savvy, so they could not order things online. So they got isolated, and there were very few mechanisms to provide them that relief and assistance. So and of course, COVID had multiple impact on their mental well-being and on their physical well-being and everything else. And of course, the other aspect that I would like to highlight here is that we don't believe that elderly are the lot that requires assistance and help. They can also act as, in preparedness phase, they can play a lot of actually a very positive role, because they may have seen in their lives, lot of such happenings. So they may have resilience, natural resilience or social resilience. So how they can contribute to preparedness in community is also very important. So having said all this, these are the major concerns I had. I'd request actually our IT department to please play the two films that we have, where you'll see our response in after the cyclone Fani in Odisha, and you'll find how we are building food security for the elderly people living alone in villages. So Vishnu, if you could just play those two films, short films, won't take more than 5 to 7 minutes. Vishnu can't hear the sound. Until the time they fix the film, I think another important and very important aspect is social security, which we find is completely lacking. So in Uttarakhand, for example, we found that those people who had pensions were a little better off than those who had nothing at all. They just lost completely, and they lost their cattle, they lost their land, and so it was a very, very difficult situation for them. Survival was a big question. Vishnu, are you finding it difficult to play? Then we'll go to the lecture and then we'll play it later.
Yes, ma'am. It seems there is some sound issue, so I'm
Okay,
just
then
fixing
we'll
it.
go to the
Yeah.
lecture. We'll play it later when we have time.
Okay, okay.
So welcome, Professor
We-
Bailey. Over to
Yeah.
you.
Before closing, I think we will run the thing. So we will welcome Professor Ajay Bailey for his lecture. Thank you.
Professor, you are on mute, so please unmute your mic.
Yes, am I audible now?
Yes, you are audible. You can make it full, the PowerPoint.
Yes.
Yes. Good.
That's okay. Thanks a lot for the invitation. I'm very happy to be here. As Professor Rajan said, I've known Professor Rajan since my student days, so more than 20 years of collaboration. And always has a big heart for young researchers, and happy to collaborate and be invited for this session. I'm also very grateful to HelpAge India, especially Ms. Data, because she has been so gracious in helping us in our projects. And last year she was there with us at the end conference of the one on urban transport. I'm happy to collaborate again with you uh, on this talk, but also to learn from you and from HelpAge and from others on how do you see these processes. So, of course, I don't see the screen. So if you have questions, please do add them to the chat windows or send them across to the moderator. I'm happy to take questions towards the end. My talk today will focus on how do we understand aging and care from the perspective of planetary health and environmental disasters, and why we need this new approach in looking at aging and care, or inequalities in access to care in that sense. So across my talk, I would give examples from ongoing research projects or projects that we have recently completed. And most of my work focuses on South Asia and the Caribbean. So the examples that I would provide are based on these projects. Um, and you will see in my, I have a background in anthropology and demography. So a lot of my research focuses at these intersections between population aging, cultural norms and care dynamics, but also focusing on the environmental context. Prior to the focus on climate change or on planetary health, my focus was largely on the socio-cultural determinants that increase precarious aging, for example, or living situations. But over a period of time, we have also seen that it's not just the cultural context, but the physical context, that is, the living environment in which people face daily challenges, especially older adults, and how these physical environments shape well-being in that sense. And that brought me to this understanding and focusing on environmental issues. So you may ask, what is planetary health? And just before we started, Anupama Datta said, "Oh, we are an implementation organization, and IMAD is a research organization." And I think for a planetary health approach, it's important to bridge both these groups. So planetary health is essentially a transdisciplinary approach. We cannot do only research, but research is done for action. Research is done for finding solutions. So within planetary health, we examine connections between human well-being and the health of the planet, recognizing that environmental changes impact global health. At the same time, changes in human behaviors or societal behaviors in terms of consumption, in terms of urbanization, in terms of economic greed that goes on, has an impact back on the environment. So you cannot just blame a kind of a linear relationship, but there's a concomitant relationship between the environment and the social life. If you look at the image on the side, you may think, oh, why do we have another term? But when you think about public health, that's at the immediate level. So that is your immediate district, neighborhood level. That's where the public health element comes in. And to a large time in history of public health, it was focused at that level. But when they start looking at when migration started to take place, and there's a lot of mobility, not just of people, but also of goods and services, that increase the spread of also infections, spread of diseases, but also movement of people across places, which created different living situations, but precarity of access to care or adaptability to certain environments. And then came the issue of, sorry, global health. And in global health, the idea is, or international health, the idea is to look at these transnational connections, and how these transnational connections impact each other. Within global health, the focus remained largely on human health. Sorry. Um, and to an extent, it almost ignored the role of non-human species or non-human environments that impact human health. That led to a larger group of people focusing on One Health, as taking into account the relationships between the human and the non-human environment. But one of the risks within this One Health approach is that the element of social inequalities, this focus on systems, the focus on access to care, rights-based approaches, all this was not so much highlighted, and that was part of the global health that could not translate into One Health. Hence, planetary health brings us this opportunity to club elements from global health and taking elements from One Health, but towards a direction of finding solutions, towards a direction of looking for solutions with communities, solutions for both human and non-human environments. See. So this is a model that has recently been suggested by Samuel Myers. And if you look at it carefully, you will see that there are underlying drivers such as societal values, rampant consumption, demographic shifts, and technology. All these are underlying factors. These push towards ecological drivers. These could be in terms of global pollution, climate change, land use, changing urbanizations. As we push further and further into the forests, there is also chances of different types of viruses entering into the living environment. On the other hand, uh, the viruses that are there in the urbanized settings start to enter into the forests. That's also affecting and endangering species over there. So these ecological drivers then have proximate causes that could be in terms of air quality, pollution, for example, places like Delhi or in Mumbai or other places which have, or Dhaka, for example, where we also do research, where we also see that air quality has a big impact on respiratory problems, not just among the older adults, among the whole household. So if you take it from a household perspective, there is a greater burden of disease or a greater burden um, on the household in terms of paying for care, given that in many low and middle income countries, there is still a lot of out of pocket expenditure on healthcare. Yeah. These proximate causes then get modified depending on the structure or the systems that exist within that particular country. So, in terms of be it societal values or health services, improved health services or adaptable health services, then increase the chance of people accessing care or accessing the right amount of care. Or in cases when environmental disasters take place, are the health systems adaptable to those things? Is the health workforce adaptable to this? The same example we could take of COVID. During when COVID hit, it was also a virus infection. Many of the older adults were the first ones to be affected by it, not just because they are of a particular age, it's also because of the situations they were in and how socioeconomic conditions, living environments coupled together to create this precarious situation or increase vulnerability among this group. All of these elements together or intersect and combine to create changing patterns of infectious diseases, non-communicable diseases, and nutritional diseases. For example, also mental health. And I'll give an example later of how a small element of reducing walking increases mental health issues. So when we think about environmental disasters or climate change, it's not just this big flood that takes place. It is also the everyday problems that older adults face in accessing services, in accessing neighborhoods. So it's both the big floods that take place, for example, in the Himachal or on in Kerala or other places, but it is also on everyday basis that they face these inequalities in terms of accessing water, accessing healthcare, accessing food or ability to buy food, for example. Um, So key ideas within planetary health that is presents literally a paradigm shift in understanding how human well-being is fundamentally dependent on health of the Earth's natural system. So you don't look at it as an additional factor, but you look at it as an internal factor or an inherent factor of understanding human well-being. That one's human well-being cannot be disconnected to the non-human well-being or the non-human environments in which people live. So both these elements need to be looked at together and adaptation strategies, for example, climate adaptation strategies, um, defined as adjustments in natural or human systems in response to actual climatic stimuli. So that could be in terms of building banks to reduce the impact of floods, or relocating people who are living closer to coastal areas, or making sure in terms of urban heat that there is access to better roofs or green roofs, or access to water. All these elements are adaptation strategies, but they are not merely optional responses. Maybe this can work or maybe that can help, but essential components of maintaining planetary health. We cannot think about urban heat and impact on lower income communities without taking into account if there is an increase of bore wells in that particular city, what happens to groundwater levels, and how decreasing water from these bore wells, for example, changes the dynamics of who has access to water, who is able to afford water, for example. Yeah. So any change or any adaptation we take into account has to be situated within this larger system, and to look at what are the impacts on across the system. The planetary health approach recognizes that this transdisciplinary adaptation should address both mitigation, that is, efforts to stop or reverse climate change, but also adaptation, strategies to manage the inevitable consequences of change. So, in any situation, in any action that people take, or governments take, or municipalities take, or village panchayats take, it's important that both these elements come into play. And adaptation, because climate change, we should not also assume that climate change and the impact of these adaptation and mitigation is a one size fits all approach, because it has differential impact upon the people, especially when we consider equity and justice issues, that in countries, in low and middle income countries, this an older adult living in an upscale neighborhood with an air conditioner and access to drinking water and free, access to better care, would have the same adaptation as someone living in an informal settlement. So adaptation strategies need to be conditioned, need to be contextualized to that particular group in which this particular care is given. And that equity and justice issues are not something that comes after, but has to be taken in the design of the program itself. And we have to take into account to understand which groups get prior access and which groups get left out in this process. And we may consider, why is aging and planetary health an important element? Planetary health affects everyone. Again, coming back to the same discussion. So, if we look at equity and justice issues, it is the older adults who face the larger burden in certain communities, right? Because environmental determinants of aging, polluted environments, increase risks for non-communicable diseases and infections. As I have said earlier, pollution, air pollution, for example, increases asthma, increases respiratory infections. Increased respiratory infections leads to increased risk of cardiovascular conditions, for example. So, in all these situations, you cannot just take one element out and say, oh, it's only the air pollution. If we change the air pollution, everything would. But it is the combined systemic issues. You may improve the air pollution situation in the city, but if you do not provide them the right kind of housing and right kind of sanitation, you are still pushing them back into these polluted environments. So, older adults also become increasingly vulnerable to disasters because they are often left out in the planning and design of these adaptation strategies. They're often focused on young, male, able bodied individuals. Thus, it's so if you take from an intersectional perspective, older adults with disability living in low income settings would face greater challenges with regard to the same flood or the same heightened rainfall that takes place in their neighborhoods. What we need is a holistic approach to create better living environments. There's a large literature within aging studies that looks at age-friendly environments or age-friendly cities, for example. But within age-friendly cities, the focus is so much on infrastructure. The focus is a lot on walking and this kind of thing, that somehow the impact of climate change, the impact of sudden cloud bursts, for example, or urban heat doesn't necessarily always come back in the planning of it. So even there, though well intentioned, age friendly environments need to also focus on the climate change impact. Is the neighborhood, is the living environment adaptable to these sudden shocks that appear? I'll give you an example. If you take a simple issue of walking, so when urban heat, the heat islands, in the scorching heat that is there, for older adults, as people age, their geographies become smaller. So they're often in their own neighborhoods. They would not go very far off. One is, this could be due to transport issues. This could be due to a kind of a hidden disability of they're not being able to, they have vision problems or they have slower gait. This creates barriers in them going large distances. So most of their interactions and social behavior then gets restricted to the immediate neighborhood. But with urban heat or with floods, for example, walking in the neighborhoods becomes much more difficult. When walking becomes difficult, they retreat back into their households. In communities or in states where there is an increase of single person or two-person or older adult only households, this becomes an issue also about loneliness. And increasing loneliness leads to further deterioration of mental health. So you can see from a very small issue, you may consider that, oh, they're not going out because they cannot walk. It has a kind of a ripple effect leading to mental health problems. So increase in urban heat, increase in flooding, or increasing of clogging of drains affects has this kind of a ripple effect. It can also have effect because we should not assume that all people who are retired have access to pensions. A lot of older adults, as research from Professor Rajan or from HelpAge has shown, that a large portion of older adults in low and middle income countries actually go to work because they have no pensions. They have to depend, or they are increasingly supporting families. Um, and when such in climatic conditions take place, their access to work is reduced. With reduction in access to work, their reduction in nutritious food, reduction in ability to pay for healthcare or medicines also goes down. So when we think about solutions, it's also about how we go about looking at changes in everyday lives in terms of the microenvironments has an impact over a period of time, over the life course, and over the time that the deterioration of the health takes place. So, a holistic approach in bringing about these solutions is to look at how we can change the immediate environment and how this changing in immediate and support in the immediate environments leads to better outcomes in the long run. And when we think about aging, aging is not just about older adults. It's about you start aging from intrauterine level, actually, because it's not so much only about older people. We have to increasingly tell people that in changing environments, changing environmental conditions has an impact on how people age. If people are constantly living in um, ill health. They have, from a very early age contracted asthma due to environmental conditions, due to pollution that exists, that continuously increases their disability or reduces um, their well-being over the life course. So when they come to 60 plus, they are further, um, their health status is further deteriorated. So when we think about planetary health and aging, or planetary health in connection to aging, we have to look at all these different elements, look at what is happening now and how this has an impact over a period of time. The other elements that we think about, as I've said earlier, there cannot be a one size fits all kind of an approach. What we need to look at is these kind of systemic inequalities in terms of how can we cannot talk about improving, kind of living conditions in informal settlements without recognizing that it is a settlement, without recognizing and lobbying the municipalities to provide these services within these settlements. So structural inequalities in cities, in villages, in peri-urban areas has a bigger impact on vulnerabilities, because the start level in which before the disaster occurs or before the environmental degradation takes place is the start process, the start capacity of individuals to have that resilience goes down. They hence become much more vulnerable to situations when the disaster takes place. So when we think about solution in terms of preparedness, or preparedness towards pandemics, preparedness towards environmental disasters, we need to think about how can we best support beyond that disaster that has taken place, or beyond the like the example that was given on when we were eating three meals, now we eat one meal. We could we could have thought of this earlier in the process. How can food packets or community oriented approaches help reduce or cushion this impact that is taking place among populations? I'll give you some examples from what we're currently doing in projects. One of them is focusing on wash inequalities in informal settlements in Pune and in Jakarta in Indonesia. And here we see is that with older adults, many of them are due to changing nature of provision of water, changing nature of who is allowed to have toilets, who is allowed to have access to toilets, are the toilets, you know, accessible for older adults. All these elements play a role in having their so you can imagine in an informal settlement in Pune, when already there is these kind of inequalities, with the arrival of monsoons, this further increases the precarity in the thing. That would mean that older adults for a long period of time would not be able to access toilets. They have to go to other extremes, or have to wait for someone to take them towards a toilet. So something as basic as accessing a toilet becomes so difficult for this particular group. In in the Caribbean, for example, we focus on infectious diseases such as dengue, chikungunya, Zika, and COVID. And there we see is that older adults, they are not just victims of this process, but older adults increasingly are also care providers. Most often it is the women and who are caring for not just other older adults but also younger people within the household. So any impact of his infectious disease on that individual who is providing care has an impact on other groups as well. So infectious diseases, when they move across groups, we've been working with chikungunya, for example, and there we see is that infectious disease is not an episodic thing. It has, for older adults, has a long-term impact. For example, one incidence of chikungunya has in the Caribbean, in Curacao, where we've been working, we followed them in 2.5 years, 5 years, 7 years durations. We see that the symptoms continue. It leads to greater arthritis, for example. That leads to reduced ability to eat, reduced ability to socialize, for example. So that increases almost in a very short period of time their aging process. So infectious diseases need not be seen only from, oh, you have a virus, you get rid of the virus to take a vaccine or you protect yourself. But what happens over a period of time once you have had this infectious disease? Similar to this, we've also been looking at water security and in terms of climate resilience. What we see over there is potable water in terms of when floods take place in Bangladesh, for example, across many coastal areas. It's not that Bangladesh doesn't know about floods. They have been having cyclones and floods, almost most of their, as they said, intergenerational transmission of this. But the occurrence of this and their ability to cope with them is continuously challenged. What still remains a big issue is you may have a lot of this seawater intruding into your living environments, but that reduces your potable water. With decreasing potable water or polluted or contaminated water, that leads to further carcinogenic conditions. And these carcinogenic conditions can also be due to infrastructures leaking out chemicals into the water. So when we think about environmental disasters can be these long-term big events, or sorry, I mean long-term uh, big events in terms of tsunamis or in terms which have major media attention on it. But it could also be of this slow violence that is taking place about oil rigs leaking out chemicals into the water. It's about fish that consume much of these chemicals, and this fish stocks are then consumed by the people, which then enter much of this lead poisoning enters into people, thus increasing their risk towards cancer. So when we think about water security, when we think about provision of clean water, we have to think about all these elements within this nature. So planetary health approach provides us this lens to situate all these seemingly disconnected issues, but actually they're very much connected. Another example is tourism. In Curacao, in the Caribbean, tourism is a big event. And once, you know, you can think it's a small island. So every morning, 8,000 people get out of their ships to get onto the island. And in the evening, they leave. But when they leave, they don't take all the trash that they have generated during that one day that they spent on the island. Thus, this trash doesn't, what do the resorts and these big hotels do? They bring it and dump it close to informal or low income settlements because there is no waste disposable unit or waste processing units. And these waste dumps that created collect water and become breeding grounds for mosquitoes. And which groups get most affected by it are the ones that are living in these low income neighborhoods around those waste dumps. Hence, you see that we can't think about changing tourism without thinking about changing the lives of this group. Or we cannot think about infectious diseases without looking at what are the economic determinants that are there behind these processes. So in terms of key approaches, integrating of the planetary health approach into the age-friendly cities and neighborhoods is important. And key for planetary health to work is collaboration and co-creation. We cannot do this on our own. We have to work with partners across the knowledge chain, across the communities. Else, we will not be able to bring solutions. We need to go through this systems thinking, how one change or one click of a button on one side of it or changing elements on one side, it has ripple effects on the other parts of the system, and how increasing focus on human health can have impact on non-human groups, or how non-human interactions, a very valid example, much literature that's coming out now is on antibiotic resistance that is taking place because of the large amount of antibiotics that are plumped into animals, which are used for consumptions, and that comes back into the human pool or human diets. So there also we need to think about these human non-human interactions. You need to think about modifying consumption, modifying the rate of consumption as well, and the rate of waste that takes place. I would like to end with this quote, which says that planetary health really compels us to rethink aging and care not just as medical or social or climate challenges, but really as pillars of climate adaptive futures. And not just for older adults, but for everyone that is going to age. Thank you.
Professor Rede, would you like to say something?
A bit to say. I think we had a very, very thought-provoking and an excellent lecture by Professor Ajay, but I would like, we can open it up for audience or any questions from anyone rather than I give a comment on that. Of course, Anupama would like to say a few words. You can do that.
Yeah, there's one question in the question answer section. Ajay, can you see that, or should I read it to you?
I don't see a chat. Oh,
The
yeah, question
QA,
answers.
in the Q&A.
What are the different challenges in the care of elderly person, aged people?
If you'd like to respond.
Yes. So one of the challenges, of course, is as we see the households or the demographic profile of households is changing. The availability of carers is changing. We also assume that a lot of the care comes from the family, whereas there is so much evidence now to show that actually family or non-family caregiving has become a kind of a coping mechanism in this process. So when we think about care, we need to go beyond our socially constructed ideas about care and think about community oriented care. And that older people are not just care recipients, but also increasingly also caregivers in this process. And that's what the link I made with intersectionality is that in especially in the Indian context, in the research that we've done, older women bear the largest burden of care. In that sense. So in that way, with the planetary health approach, it is about also supporting and making sure these carers have the chance to also prosper.
Absolutely. And we did one research with older women a couple of years ago, and I remember a substantial segment saying that I do it, but I feel burdened.
Mm.
And I don't have a way out because I'm so completely dependent on family for support.
Yeah.
Financially, I'm so broke that can't say no to them. So big challenge. Uh, are there any other questions, Irsha, that you can see? I don't know if a clerk would like to ask a follow-up question. I don't know if he has one. Because we don't have any other question in the Q&A. Or Irshad, you can ask a question if you like.
Isat, you can also
Yeah,
ask question before you give the vote of thanks. Yeah.
yeah. Thanks, Professor Ajay Bailey, for this wonderful lecture. It is very interesting because recently I read one article by, Arun Balachandran and all, about it's like a life course approach to aging. It's very interesting. Now, this is one of the topics I was really interested to hear. It's very fascinating, but I'm really interested to know to what extent you are doing a lot of research and projects in Indonesia and different countries, and how you're actually convincing, policymakers to take action. That's very important because what I understand is, the intervention should be done at very, micro level, uh, because the context is very important, and the factors that influence aging or health, whatever the outcome, that is also very uh, functioning at the very micro level. So how you're actually convincing people with policy, with your projects and all. Thank you.
So it's not always easy. But it's really goes with this idea that at the design phase already, that we bring people into the discussion and we say, let's let's recognize this is a problem first. That is actually the start of the issue. It's not so much about finding solution immediately, but recognition that it is a problem and that we're going about to find a transdisciplinary solution for it. For example, in the Caribbean, when we worked on the COVID case, especially on risk communication, there we worked with not just policy officers, but also government communication departments, because it's also these departments that need support in how to communicate about certain conditions. How do you keep distance? What are the consequences of it? So there you we created kind of co-creation workshops to look at how these messaging and information can be packaged for different groups of people. So influencing policy or influencing practice doesn't happen in one direction. It needs a constant communication and feedback across both groups because it's such an adaptable situation. Like for example, in St. Martin, they said, "Oh, COVID is not a big thing for you. For us, the cyclone was the bigger thing because that blew our roofs away and destroyed our houses, whereas COVID, one person is sick and then we can still manage." So you can think that it's when we think about risks, we think about it from, oh, this is a risk for that particular house, but also we need to understand how certain groups live constantly in risky environments, and how do you communicate that and condition your message to those particular groups.
Thank
Very
you.
Yeah, I
important
think
point.
Yeah, I think that what Ajay Peli spoke, I think we require now more research on this, expanding the ideas because we need to create new evidences, not the existing evidences. Look at especially the aging societies which are super aging, like Kerala and Tamil Nadu. I think probably we look at it as some ideas what you are talking about with our UNFPA project also.
Mm.
So that see we can, because UNFPA project mean we will be having some meeting with the Ministry of Social System Government, to provide our findings, maybe a policy flip, so that I think you can also contribute whatever way to our questionnaire and our research, and that will be really great to take the conversation further on this subject. I'll stop here, and if you have no questions, I can ask Irsad to say a vote of thanks on behalf of the IMAR. He is currently with us working on the UNFPA project, and Irsad did his PhD from IIT Chennai, and he worked probably 2 years at the VIT Vellore. Now he is with us.
Yeah. Sir, is there any more questions? I think somebody asked it.
Okay,
Yeah.
I can.
There's another
Ashi,
question.
yeah, Arish Khan, somebody.
Gender disparity in healthcare.
My question is, what about gender disparity in healthcare among how to examine gender? Yes, so gender gaps in healthcare is unfortunately a topic that is continuing to be researched without a kind of solutions for it. Um, but when we think about gender disparity, especially in climate change, it's about in post-disaster situation, how do we bring gender parity in terms of them getting the right kind of services, in terms of who gets access to resources, who gets access to food packets, for example. How can we ensure that women, older women, or even younger women for that matter, have a say in this preparedness approach? I think that's where we need to take into account. Also, making sure that when there is health expenditure costs that post disaster settings, that these costs are waived out for the ones who cannot afford it. Right. So in that way, again, one size fits all approach doesn't work. It has to be really contextualized to that particular group.
And I think we have a big challenge because we have a country of a size of a continent. So I think for us, if we take, nuanced approach is generally requires a lot of patience, and it's very slow in showing results. So we just get angry and frustrated quickly and say that, oh, nothing is working. So I think for Irshad, I think I'll say that look at us. We have been working and have been saying the right things for such a long time without losing hope that one day somebody in the system will actually take it very seriously. And gender, for example, like Professor Bailey said, that gender has, we have discussed it like forever, but what we see on ground takes a long time. And when we deal with social systems, when we deal with perceptions, it's even harder. So a lot of patience is required, but the mantra is that never give up. So Irshad, over to you. If you have no other questions,
Yeah,
we'll just
I think I just have one more question. Like it's related to
yeah,
methodology.
sure.
Like it's how do you bring this inductive and deductive approach? Because when you go to field, you have very small cases, very narrow cases, which you can make the process of induction. Like you can't generalize, because when you take a case and the case is very specific, and when you go to other place when their case is very different, like whether it is like as you said, uh, you know uh, the climate disaster and COVID, which is different in different communities. So what is the scope of inductive approach, or is it only like deduction or what? Yeah.
Um, I don't think we should look at it from an inductive or deductive approach or from a generalization approach. The issue of climate change affects everyone. That is our starting point, right? How do you go about providing support and services or adaptation strategies that are context and group specific? It should be the focus. And I mean, of course, when you do comparative research across countries or across islands, you would see that the processes remain very much the same, but the impact changes depending on the socioeconomic conditions of those particular groups. So when you make solutions or you prepare frameworks or elements, you have to also take into account these differences. And that adaptive policy making or evidence-based policy making is to consider evidence both at the macro level but also at the micro level. Just to avoid that it becomes it should not become an academic exercise of looking for significance. I mean, the threat of climate change is a significant issue already. We should not go about as researchers looking for significance of climate change. We should rather look at what solutions can we provide in the particular groups that are there. Yeah.
Yeah. There
You
any
can do your
questions?
job.
Yeah, I think we can wind up as Professor Rajan.
Yeah.
Yeah. So thank you, Professor Ajay Beli, for joining us today. I feel very honored and privileged to get this opportunity to propose vote of thanks on this special occasion of this webinar on aging and care in the era of planetary health and environmental disasters. Actually, this was a long, we had discussed about this webinar for last 1 month, and this is what we had. And first and foremost, on behalf of the, both IMAD and HelpAge India, I would like to express my sincere thanks to Professor Ajay Beli for accepting and delivering a thoughtful lecture. The lecture was very enriching and engaging one with an emerging relevant theme. I'd like to express my sincere gratitude to Mr. Rohit Prasad, Mrs. Anubama Datta, and Dr. Kalling. She is not well today, and Vishnu from the IT department of HelpAge India, New Delhi office, for their consistent support in organizing the event. I also express my sincere thanks to Professor S. Rajan and Ajay Karuvalli of IMAD for their inputs in planning the webinar. Not but least, I would like to thank all the participants of the webinar for their active engagement and contribution. Thank you all for joining this event, a successful one. Thank you.
Thank you, everyone. Thank you. See you soon, Ajay.